Before you swallow your morning vitamins today, there is something you need to know. A growing body of research is showing that four of the most popular supplements seniors take every single day are not just failing to help. In certain doses and certain forms, they are actively working against your health. We are talking about vitamins that are sitting in almost every senior's medicine cabinet right now. And on the other side of this, there are four nutrients that research links to stronger bones, sharper memory, better sleep, and in one case, a significantly lower risk of early death. By the end of this video, you will know exactly which vitamins to stop, which ones to start, and why the difference matters more than most people realize. Stay with me because the number one vitamin on the must-take list is the one that changes everything. The reason this matters so much comes down to one simple fact about aging. The body at 65 is not the body at 40. The liver processes things more slowly. The kidneys flush less efficiently. The gut absorbs nutrients differently. And the nervous system becomes more sensitive to excess. So a vitamin that was perfectly safe and beneficial at 45 can become a liability at 65. Not because the vitamin changed, but because you did the same pill, a completely different outcome. And the troubling part is that most supplement labels do not warn you about this. Most doctors do not have time to walk through every interaction in a single appointment. So the information gap stays open, and seniors keep taking vitamins that are quietly undermining the very health they are trying to protect. Here is what makes this different from the usual health advice you have probably seen. This is not about adding more supplements to your routine. It is about being smarter about the ones you already have. And for four specific nutrients, the research is remarkably clear. These are not fringe ideas or early-stage theories. They are backed by peer-reviewed studies published in major medical journals. Once you understand why these four work and why the other four cause problems, you will not look at your supplement bottle the same way again. You will be more informed than most people making these decisions. And that knowledge is genuinely powerful. Vitamin A is one of those nutrients that genuinely sounds like it should be on everyone's list. It supports vision, it supports the immune system, it plays a role in skin health, and in the right form and the right amount. All of that is true. The problem begins when the form is retinol, which is the synthetic version found in most multivitamins and liver-based supplements, and when the dose accumulates over time in a body that can no longer clear it as efficiently as it once could. Vitamin A is fat-soluble. That means it does not wash out through urine the way water-soluble vitamins do. It is stored in the liver and in fatty tissue, and as the liver ages and slows down, excess retinol does not disappear. It builds. Month after month, the concentration rises, and at a certain point, it begins to cause real damage. Robert, 67, has been taking a senior multivitamin for 3 years. The label shows 2,000 micrograms of retinol palmitate. He never read the fine print. Over the past year, he has been dealing with increasing joint pain, dry skin, and a persistent foggy feeling he put down to getting older. When his doctor finally checks his vitamin A levels, they come back significantly elevated. The retinol in his multivitamin had been quietly accumulating the entire time. Research published in the European Journal of Clinical Nutrition has found that seniors with elevated vitamin A levels face a meaningfully higher risk of atrial fibrillation, which is an irregular heartbeat that raises the risk of stroke dramatically after age 65. The safe upper limit for retinol is around 700 micrograms per day for women and 900 micrograms for men. Many senior supplements exceed that without the user ever realizing it. The fix is not to eliminate vitamin A entirely. The body still needs it. The fix is to switch to beta-carotene, the form found in foods like sweet potatoes, carrots, and spinach. Beta-carotene is converted into vitamin A by the body only when it is actually needed. There is no risk of overdose. The body self-regulates. Retinol does not offer that safety net. If your multivitamin contains retinol or retinol palmitate, that is worth a conversation with your doctor. Iron has been marketed to seniors for decades as a solution for fatigue, weakness, and brittle nails. And for people who are genuinely deficient, Iron supplementation can be life-changing, but here is the part that almost no one explains clearly. After 60, the vast majority of seniors do not need extra iron. And for those who do not, taking it anyway is one of the quietest ways to damage your organs. Iron is not flushed out of the body the way water-soluble vitamins are. It is stored in the liver, in the heart, in the pancreas. Men stop losing iron after puberty, women stop after menopause. Without active blood loss from surgery, an ulcer, or another confirmed cause, the body has no efficient way to get rid of iron it does not need, so it accumulates. And accumulated iron causes oxidative stress, which is a process where unstable molecules damage healthy cells and accelerate tissue aging. Gloria, 71, has been taking a multivitamin containing 18 milligrams of iron for 4 years. She was never tested for a deficiency. She took it for granted that the iron in her multivitamin was doing her good. Chronic fatigue, occasional brain fog, joint discomfort. When her doctor finally runs a serum ferritin test, her iron stores come back significantly elevated. The iron she had been adding every day had nowhere to go. A 2018 study published in Alzheimer's Research and Therapy found a connection between excess iron levels and increased risk of dementia in older adults. Other research has linked iron overload to heart disease, liver damage, and in some cases, an elevated cancer risk. The symptoms of iron toxicity, fatigue, joint pain, memory problems, heart palpitations are so similar to normal aging that most people never suspect the cause. The action step here is straightforward. If your multivitamin contains iron and you have not been tested for a deficiency, ask your doctor for a serum ferritin test. If your levels are normal or elevated, switch to an iron-free senior multivitamin. Iron is essential, but only when it is needed, and only in amounts your body can actually use. For decades, the message has been simple. Want strong bones? Take calcium. It is in every pharmacy, every bone health ad, and nearly every senior multivitamin on the market. And calcium is essential. Without it, bone density declines and fracture risk rises. But the way calcium is being taken by most seniors in large doses alone, without the right supporting nutrients, is not protecting bones. In many cases, it is damaging the heart. Here is why. When you are young, your bones absorb calcium efficiently. Hormonal signals direct it exactly where it needs to go. But after 60, that system weakens. Bones absorb calcium less effectively, and the calcium that is not absorbed does not simply disappear. It migrates into the arteries where it hardens blood vessel walls, into the joints where it contributes to stiffness and pain, into soft tissues where it causes calcification that is very difficult for the body to reverse. Calcium does not work in isolation. It needs vitamin D3 to be absorbed from the gut. It needs vitamin K2 to be directed into bone tissue and kept out of blood. Vessels. It needs magnesium to prevent it from hardening soft tissue. Without those partners, calcium is essentially unsupervised, and an unsupervised mineral in an aging body is a problem. The better approach is to prioritize calcium from whole foods, leafy greens, sardines with bones, yogurt, almonds, and chia seeds. If supplementation is still necessary after that, it should be combined with D3, K2, and magnesium, not taken alone, and the dose should be discussed with a doctor based on actual dietary intake and blood levels. Vitamin B6 is water-soluble, which is why most people assume it is completely safe no matter how much they take. The logic seems sound. Water-soluble vitamins flush out. They do not accumulate. There is nothing to worry about. But B6 is an exception to that general rule, and the consequences of ignoring that exception can be serious and in some cases permanent. When B6 is taken in high doses over an extended period, it does not simply pass through. It builds up in nerve tissue, and over time that buildup becomes toxic to the very nerves it is supposed to support. The condition is called peripheral neuropathy, and it involves progressive damage to the nerves in the hands, feet, and sometimes the legs. Research published in Neurology found that older adults taking high-doses B6 supplements had roughly double the risk of developing nerve damage symptoms compared to those who stayed within recommended limits. The official upper safe limit is 100 milligrams per day, but evidence suggests that even 50 milligrams taken daily over months or years can cause toxicity in seniors whose livers clear substances more slowly and whose nerves are already more vulnerable. Linda, 69, started a nerve support supplement 2 years ago because she was experiencing tingling in her feet. The supplement contains 100 nanomolar of B6 per capsule. She also takes a daily multivitamin with an additional 20 milligrams. Over the past year, the tingling got worse. Numbness showed up in her hands. She has had 2 falls from poor balance. When her doctor reviews her full supplement list, the total B6 intake gets flagged as a likely contributing factor. The nerve damage she came to the supplement to fix had been made worse by it. Seniors only need about 1.5 milligrams of B6 per day for women and 1.7 milligrams for men. Food sources like chickpeas, tuna, turkey, and bananas provide that amount comfortably. If your multivitamin or any nerve or energy supplement contains more than 5 to 10 milligrams of B6 per serving, it is worth flagging with your doctor. More is not better. In this case, more is genuinely dangerous. Now that you know which 4 vitamins to reconsider, let us talk about the 4 that research consistently supports for seniors. These are not trendy supplements or new discoveries. They are well-studied nutrients with decades of evidence behind them. And the last one on this list, the number 1 vitamin you must take daily, is the one linked to the most dramatic reduction in overall mortality risk we will discuss today. Let us get into it. If there is one nutrient that is quietly depleted in the majority of seniors and almost never talked about in the right way, it is magnesium. Magnesium participates in over 300 biochemical processes in the body. It regulates heart rhythm. It supports muscle function. It plays a direct role in sleep quality, blood sugar control, and nerve signaling. And as we age, the body absorbs less of it from food, while common medications like blood pressure pills, acid reflux drugs, and diuretics actively drain it further. A 2018 study published in the journal Nutrients found that magnesium deficiency in older adults was associated with a 50% higher risk of atrial fibrillation, increased risk of cognitive decline, and higher levels of chronic inflammation. Seniors who correct a magnesium deficiency frequently report improved sleep, fewer muscle cramps, sharper focus, and more stable energy. The best forms for seniors are magnesium glycinate or magnesium citrate, both of which are gentler on the digestive system and more absorbable than the cheaper magnesium oxide found in many basic supplements. A typical range discussed in clinical settings is 250 to 400 milligrams per day, though the right dose depends on individual health status and should be confirmed with a doctor. Vitamin D3 is frequently called the sunshine vitamin, but by the time most seniors reach their mid-60s, their skin has lost more than half its ability to convert sunlight into usable vitamin D. Add in more time spent indoors, the use of sunscreen, and geographic location, and deficiency becomes remarkably common. Vitamin D3 is not just a bone nutrient, though it does play a critical role in calcium absorption and fracture prevention. It functions more like a hormone, influencing immune response, mood regulation, and cognitive function. Research has consistently linked low vitamin D levels in older adults to increased risk of respiratory infections, depression, and accelerated cognitive decline. The important detail most people miss is that vitamin D3 is fat-soluble. Taking it on an empty stomach or with a meal that contains no fat dramatically reduces how much of it actually gets absorbed. Taking it alongside a meal with healthy fats such as eggs, avocado, olive oil, or nuts can increase absorption by a factor of 2 or 3. For seniors, this single adjustment can be the difference between a supplement that works and one that passes through without doing much at all. Doing should be guided by blood levels, specifically a 25-hydroxy vitamin D test, and managed in consultation with a healthcare provider. Omega-3 fatty acids, particularly EPA and DHA, are among the most consistently studied nutrients in senior health. They are not vitamins in the technical sense, but they function as a foundational anti-inflammatory agent in the body. And for seniors dealing with chronic low-grade inflammation, which is one of the driving forces behind heart disease, cognitive decline, and joint deterioration, omega-3s are one of the most well-supported interventions available. Research published in the American Heart Association's journals has indicated that regular omega-3 intake may help reduce triglyceride levels, support healthy blood pressure, and lower the risk of cardiac events. Separate lines of research have linked higher omega-3 levels to slower cognitive decline and reduced risk of depression in older adults. The primary food sources are fatty fish like salmon, mackerel, and sardines. For those who do not eat fish regularly, a fish oil or algae-based supplement providing 1,000 to 2,000 milligrams of combined EPA and DHA per day is a commonly discussed range, though dosing should be reviewed by a doctor, particularly for anyone on blood-thinning medication. Now, here is the one we have been building toward individually. Both vitamin D3 and magnesium are powerful, but research has begun to examine what happens when both are corrected simultaneously in seniors who are deficient in one or both. A landmark study published in the British Medical Journal found that seniors who maintained adequate levels of both vitamin D and magnesium had a 36% lower risk of death from all causes compared to those who were deficient in either. That number is not from a single small study. It is drawn from a large-scale analysis and has been referenced across multiple subsequent reviews. The reason the combination matters so much is that magnesium is required for the body to activate and use vitamin D. Without sufficient magnesium, vitamin D cannot be converted into its active hormonal form. So, taking vitamin D alone without addressing magnesium status leaves a critical gap. And taking magnesium alone without vitamin D means a key piece of the activation pathway is missing. Together, they function as a system, and the data on that system is among the strongest in senior nutrition research. So here is where we land. 4 vitamins that research suggests seniors should approach with serious caution: retinol form vitamin A, iron supplements,